Oh my God. Okay.
There's the intro. What do you think? That's down the street. I did a little time lapse.
Okay. Nice. Because we're supposed to look over there.
No, you look at me. Most people aren't going to watch the live stream. I said most people aren't going to watch the live stream. They're going to listen to the podcast anyway. Rupal Patel is on the podcast. No stranger to the show, Rupal. Welcome to Anaheim.
Thank you.
This was my first CSM 10 years ago. How many are you at? What's your CSM?
Probably around 30.
Wow, really?
Yeah, I've missed maybe 4 or 5. I love CSM.
I think I missed 1, so this is 9 or 10 for me. Favorite city for CSM? What do you prefer?
Probably New Orleans.
Really?
Yeah.
I figured you were going to go I think you were going to go to San Antonio.
Yeah, San Antonio, but I'm from Texas, so
yeah.
I go to San Antonio a lot.
I enjoyed New Orleans. I enjoyed San Antonio. Not that I don't like DC.
Yeah.
It's cold, man.
And I mean, like Southern California. It's always fun to come
It's not
to Anaheim.
bad.
I have friends here, and today's my birthday. So
Today's your birthday?
Today's my birthday.
We get Rupal on her birthday. Well, happy birthday.
Thank you.
That's
I got
fantastic.
to go to Disney yesterday, so that was fun.
What was on the hit list at Disney? What was have to see?
They have a new Star Wars.
Did you do it?
Yeah, we went there. Rode in the Millennium Falcon. I was one of the gunners,
good.
To try and defend the Empire, I guess.
Did you drop 3 bills on a lightsaber?
No, we didn't do that.
Smart
There were
move.
quite a few
Lightsaber?
the stormtroopers walking around
That's
asking
kinda cool.
people for identification.
That's
and we all thought that was
feels very
what's going on in the world right now.
Entertainment life.
Yeah.
You're challenging PTs to confront inequity, engage in advocacy, and become clinicians for life, not just for episodes of care. So we'll start with this. Why is the profession in an inflection point now? Because it's your birthday, or are there other reasons? Why are we at an inflection point now?
Well, I think we're at an inflection point because I feel like we're still a profession that's growing. We're about 100 years old, right? We had a birthday a few years ago. A couple of years ago. And I think, we were born out of, I call us an extra appendage of the, primary care physician that, with the world wars, and we took care of soldiers, and we took care of, after someone got injured, and then now what happens, right? But now as we've evolved, and now we're in a doctoral, education standpoint, now I think we really need to think about how do we actually help transform society. In order to do that, we have to look at the big killers in the world and not just treat people, but like, how do we stop heart disease? How do we stop cancer? How do we stop, chronic pain? And so to do that, we really have to go upstream, and we have to think about those kind of things. So from education to practice, I think we're at an inflection point that we're evolving into our second century as a profession. And we really need to think about, our mindset and our frame of who we are and what we can do to transform society, and not just take care of people after an injury or to prevent just a musculoskeletal injury, but to really manage, lifestyle and manage these chronic conditions.
It's nice to put on a wall. It's nice to put on a t-shirt, right? Transform society by optimizing movement to improve the human experience. Did I get it? Yeah, I think I got most of the words, right?
Yeah.
But how do you do that? So how do social and structural determinants shape outcomes? That sounds like upstream, downstream to me.
Yes, it does. And, I think as physical therapists, we don't necessarily focus on some of those upstream factors because we're so kind of focused on, okay, here's the person with the shoulder injury or the back pain, and I've got to fix this. But then we're sending them back in environments where health happens, where they work, where they play, where they, pray, where they're growing, where they're going to school. And so if those environments, social as well as physical, are not optimal for them to continue sustaining what we did in the clinic, we're not doing that patient any service. They're going to be back in the system. It's going to cost us more. We're going to rehab them again. They're going to go back into a system and a structure that's not conducive to health. So I think screening for and addressing those things, I think a lot of people think, oh, well, I'm not a social worker. I'm not a psychologist. That's not my lane. But it's all of our lanes. Again, if we want to transform society, if we want to optimize that movement, improve that human experience, we have to kind of think about, okay, what is the whole health of this person? What is it that we're trying to do here with this person? Not just repair their shoulder or, knee pain, but okay, they're working in a factory and they're going to have to stand all day. Well, how is that going to impact them? I've rehabbed their knee, but can they stand for 8 hours a day? With only 2 breaks and a 30-minute meal, And so I think just looking, at those things, the structural and systemic things are so important. And the data is so strong. where you live determines your mortality. Like
zip
that's
codes.
Yes. And
I think
so
it was
we
Mark
have to
Milligan
look at
once, the first time.
Yeah,
I mean,
first
he didn't
CSM.
invent it,
Yeah.
but like he
Yeah.
pointed it out, and I was like,
Yeah.
I remember
Yeah.
asking people that I trust, I'm like, is this true? And they're like,
It is so true. And
Yeah.
then and that same slide, I still use that slide from Mark. And he looked at, like, in Austin, Texas, where are all the PT clinics versus where are the populations that actually have the biggest health disparities. And there's no clinics on that side of town.
What on the other side of the tracks meant.
Yes,
like it wasn't it's
literally.
just not an ism.
Yep.
It was the thing. And I'm like, oh
Yeah.
wow.
And you can put, literally you can look at those maps in every city.
Predict.
And you see the same thing, that, where's the care, whether it's physical therapy or other care, and it's not in the places, the zip codes where the population has the most disparities and needs us, and I mean, that's true in Houston too, where I live, and it's challenging because, the patients that need us, we're not there.
Yeah.
And so those structures and systems, and then zip codes, so looking at our patient's zip code and saying, oh, you live here, and then looking up, okay, for that zip code, what is the mortality? And how is it different than the clinic that they're coming to? And what do I need to do to change or help the patient or empower the patient? So I think a lot of times we think we have to be the one to change their environment. No, we have to be the one to empower our patients to say, hey, this matters to your health. I can help you with this. But now when you go back in this community and you have poor sidewalks, there's poor safety, poor lighting, there's crime. Like, those are the things that need to change for you to continue to walk, continue to ride your bike, so that you can stay healthy and not end up back in the clinic, right? And so that some of that is very different way of like educating ourselves and educating, our patients than we've done. Like, okay, go home and do your exercises, kind of thing.
Yeah. Why is this statement? Apathy is more dangerous than resistance. What does that mean?
Oh my gosh. Well,
how do we dig into that?
Well, I think if you're apathetic and you stay home and you don't get out there to advocate, then things won't change. And, I feel like that happens a lot in our profession. That happens a lot in our country.
Yeah.
If you just look at elections, and the last time we had elections, more people stayed home than who voted for the winning candidate. And so apathy, and then people are upset about some things that are going on, but like, okay,
what'd you do about it?
Yeah.
Where were you?
Exactly.
I feel like apathy is more dangerous than resistance, because once someone becomes apathetic and they're like, I'm out, the chance of getting them back is super low. Where just resistance means like, I'm still questioning you. I don't believe you yet.
Yeah.
There's still a chance there.
Yeah.
But so like apathy leads to, I feel like I'm trying to be Yoda here. Like apathy leads to just disenchantment, and then you don't get a second bite at the apple sometimes.
Yeah.
I'm looking around this CSM Expo Hall, and every, second person is a student or a new grad, and they're bright-eyed and bushy-tailed right now.
Mm-hmm.
And how many will be gone in 5 years, right? They're super excited. What can we do to prevent that? Because once they become apathetic, ounce of prevention, pound of cure.
No, that's so true. That's a very good point. And I think, as an educator, I want to be mindful of that. I tell my students all the time, I teach health policy right now, and like trying to think about them becoming advocates for their patients and for our population, and like versus like it's too hard and the resistance is futile. That's Star Trek, not Star Wars, but I'm a big fan of that too. But, it's like, no, empower yourselves, and, so that you will have a profession. I always tell them, like, I'm a little bit on the tail end of my profession, but you're the future. And like, I advocate for the future and for the future of our profession, and you're going to be working in the future. So, advocate for that. But I think that's a tough sell sometimes, because there's so much information, misinformation, disinformation out there. And people are just like, I just need to focus on what I'm doing with my patient or in school, and I'll figure all that out later. And then later comes and they're like, whoa, I have low reimbursement. I can't access my patients. This, why? Oh, forget it. I'm out. I'm out of PT. I don't want to be in here anymore. I'll find something else, And so it is. I think it's an inflection point, like you said. And, we need to be better advocates. And I feel good about, I think, the next generation of therapists, because in their own way, they're finding ways to do that, and I think sometimes little bit braver. I mean, I look at high school students here, in Texas, like a lot of them walked out last week, and I mean, in my school district too. And like, so proud of them, for like standing up for their peers and people in their schools that they feel like, maybe were not treated justly, and so I think that's good. That makes me a little bit, hopeful,
optimistic, and hopeful.
Yeah.
I do want to say thanks to Steve Cohen and Sarah Health for supporting the podcast. Remote care platform, helping clinicians boost revenue without having to add staff. Sarah automates daily patient check-ins through simple text messages. That means no apps or a login for me to forget, which happens a lot. Just better follow through and better outcomes. Learn more at sarahealth.com. That's SARA health.com, sarahealth.com. How can PTs advocate within their own spheres of influence? That is their network, not because when you hear advocacy, you think I'm taking a trip to
DC or Austin.
Correct. So how could they do the advocacy thing? This is fun without getting off their couch or at a party. How do you explain to do that?
Yeah. Well, it's so many different ways, I feel like. And I think APTA makes it a little bit easier because we do have action apps and you can sign up for news alerts and, you get information literally and you just press, it takes 5-10 seconds to just press a button if you don't want to make something personal and advocate with at least at the federal level, right? And then I think the same thing, the patient, like if they come to me and say, hey, I'm not getting reimbursed for, at this session, or my sessions are limited, and you're telling them, hey, I can only see you for 4, and they're like, what do you mean? I thought, okay, here's how you can advocate for yourself. Let's look up and see who represents you. You can send a letter, you can call, you can give them a little script, right?
Sure.
And then there's like, lots of those things that take very little time, and you can do it from the couch. Phone calls, emails, tagging on social media because, everybody's looking at that.
Sure.
So, and then even with your insurance carriers, like a lot of times it's like, call them and let them know, hey, why you think you need more care and what's going on. And,
be the fly in the ointment.
Yeah.
Squeaky wheel.
So I think there's lots of different ways, but at the federal level, I feel like the APTA, action apps and things that we have are really helpful, and it makes it easier for us to do that. And then, with patients, just empowering them, even saying, hey, make a little video of like why this is affecting you and send it to your congressman or your state legislature. Let them know, hey, I'm Mrs. Jones and I live in this neighborhood and I'm in PT with this person and this is what she or he is helping me with. And I need more of that so that I can do X in my home or at work. Like teaching patients to do that, because that's more powerful than me, the PT, going to my congressman.
And it's larger. It's larger number.
Yeah, larger number.
Last question I'll ask sounds like a good one. What discomfort do clinicians need to embrace? Usually we say to avoid at all costs, but that can't be the way, right? So what discomfort do clinicians need to embrace?
I think the biggest discomfort is kind of thinking about looking at things holistically, and that's uncomfortable because maybe that's not what I'm trained to do. That's not what I'm good at. But that's what's needed. Like that's what the patient needs. That's what the community needs if you're in the community. So like embracing that discomfort and then putting yourself out there a little bit, learning, of course, as clinicians, we know where to look for good information, evidence-based, who to go to, networking with people who are in those spaces. And we need to embrace that because, again, it's about improving that human experience. And if we're uncomfortable with a patient who is just like psychologically depressed or has other symptoms, and you're like, oh my God, okay, go see a psychologist first, not me. Come back and see me after that's done.
Right.
Like that's because that's uncomfortable for me.
Right.
I haven't done that with many patients. And so then versus like, okay, tell me more. I may not be able to help you, Jimmy, but I want to listen and see what we can do together and if I can refer you to someone or something like that. So that's uncomfortable, but that's so important. And that'll earn us the trust of that person.
Which is the game we're in.
Which is the game we're in. And then opening up a conversation that, they're probably thinking, you know what, she's going to ignore this. Like she's just going to focus on this. But then when you do, then you earn that trust and then you get into some things that maybe are really important, and that will improve their human experience, which I think is what we're all about.
We have a tradition on the show. It's called the parting shot.
This is the parting shot. One last mic drop moment. No pressure, just your legacy on the line.
You got to drop the mic. Do you want to say thanks to U.S. Physical Therapy? We're at their booth right now at CSM.
Thanks,
we're waving at them. Thank you. Network of clinics focused on developing clinicians across the country, not burning them out. With leadership tracks, mentorship, career growth, and long-term stability, USPH supports PTs who want to build futures in this profession. USPH.com. It's USPH.com. So what's your parting shot, Rupal? No pressure.
Oh, there's no pressure, right?
No pressure whatsoever. We keep it low.
Yeah. I think my parting shot would be like, it's very cliche, but, I am an immigrant to this country from India. And so things that Mahatma Gandhi has said over his lifetime are so like part of who I am. And really, I think all of us need to be the change we want to see in the world. And it seems really cliche, but like if you really think about it, like all of us can do that in some form or fashion. It doesn't have to be big, and you don't have to be a person in a powerful position or anything like that. The Mahatma was just a simple man, and yet he freed a country, and led a resistance. And so you don't have to be a person in power or position to do great things. You can be that human being that can change the world. So.
Rupal Patel, happy birthday again.
Thank you. Yeah.
Thanks for stopping by here at CSM.